All right, team. Lots of news to get to today. First, I want to reiterate, we talked about this last week, HIPAA, new forms required for all practices. They need to be your digital forms. You have to have it posted in your practice. Feb 16th is your deadline. The ADA has sample forms. I'm sure if you put it in Gemini or ChatGPT, you can also find them. It specifically addresses substance abuse as a non-disclosure issue. It's added into the language. Feb 16th is the deadline, so please make note of that. Make sure that all your paperwork is up to date. I don't think you have to redistribute it to all your existing patients, but you do have to be sure you're giving it to new. And when you're requiring them to sign it, be sure to give them the new form. Lastly, publishing in your office where it is visible for all patients, your revised privacy policy notice should be updated as well. The EPA is re-looking at the fluoride issue. It's been a hot topic. We've had states leaving fluoridated municipal water supplies. There's a lot of activity going on. The EPA has decided to also get into this discussion as well. And they're trying to accelerate the review, which for the government, Godspeed. I mean, that's really not what they're known for, but they're going to try to push this forward to do some additional studies, long-term studies on health complications that might be associated with municipal water supplies that have fluoride in it. There is an open comment period. The ADA has published some deadlines for that. So if you're interested, want to participate in that debate, and I would encourage you to do so, just search up those timelines and open opportunities to provide comment. Usually there's either a web form or some phone number you can call or something that you can submit that information. I think this is a really interesting new discussion that's going to get a lot of debate. So there's a new House Resolution 1 for capping federal loans for graduate and professional students. This is definitely going to have pretty heavy impact in the dental industry, where the average student loan per year is almost approaching $100,000. They want to cap it to $20,000 for graduate students and $50,000 as an annual limit for professional students. This is going to sound terrible, so I'm just going to go ahead and put it out there. But you know it's bad when the Hygiene Association is also getting on board saying, no, this is not going to cut it. You can't cover graduate students doing hygiene programs at $20,000. Not even to mention how expensive dental school has become. So everybody's sort of jumping in. Lots of professional associations are saying, wait, this is not going to cut it. If you decrease these loans, students aren't going to be able to get funded to attend these schools. I kind of think everybody has some responsibility in this. Maybe the professional schools have gotten just a little bit too expensive and access to money has become more challenging. To me, this seems like a roundtable opportunity to work from both angles to maybe find a happy medium so that people don't have to go into so much debt to pursue these professional careers. But I digress. This is current HR 1. It is up for discussion. They're accepting comments through March 2nd. So if you do have any that you'd like to share, and obviously I do, so I probably should provide some as well, you can go online, find the portal, and provide those open comments to your legislatures so that they can provide that as well. Okay, Florida, I see you getting a dental health aid therapist sneaked in. All right. Not the state that I thought would be on the list of passing dental therapy legislation, but here we are. Now, I think this is a combination of a lot of challenges that Florida has had recently. Obviously, an incredible population growth, not putting out enough dentists licensed to be able to provide dentistry in the state. Obviously, not putting out enough hygienists, because that's pretty much every state in the U.S. And then on top of that, Florida has always been historically one of the most tight boards to get a license to be able to practice in their state. Reciprocity, no thank you. Can't come here and practice if you've been licensed anywhere else. They've had a private licensing board even long after North Carolina, which was one of the last licensing boards to stand up for independence. Florida still remained. Maybe that has a little bit to do with why we're now faced with the idea of doing dental therapy and mid-level providers in Florida. I'm kind of surprised. I thought if you're going to be the staunch conservative on licensing board, maybe that would also translate to mid-level providers, but there are multiple counties now in Florida that have no dentists, and access to care has become particularly difficult. And if you think about the population growth alone, there's a huge gap in the access to dental care. So we'll see how all this plays out, but color me surprised. And the last little bit of information that I absolutely have to share, if you've been watching the Olympics like I have because you love the country that you were born in and you love competition, so the combination is kind of off the chain for you, literally something you live for every 2 years. Well, here I am watching the Olympics, and to my great enthusiastic surprise, we have a dentist. Yes, again, Tara Peterson coming in curling. Now, lucky for her, I got addicted to curling just a couple days ago. I know, I'm a late bloomer, and it is kind of cold, not a big cold sport kind of fan. Was watching the co-ed team pull through to get a silver. Tara starts her pursuit this evening. How can we not cheer for our fellow colleague? And honestly, if you follow her on Instagram, she's pretty damn funny as well. She has a fit of the day, and they're having a great time over in Milan. So Tara, if you happen to find us on the internet somewhere, some way, first off, we'd love to get you on the show because this is the absolute type of stories we love to showcase. But second, good luck, Godspeed. And I hope you can curl those giant stones just as best as you can. And that's the news.